At Field Medical Training Battalion West, students will undergo difficult and realistic training. Students will complete 5 written examinations, 6 medical procedure evaluations, 4 conditioning hikes, and multiple inspections. As a Navy corpsman, you must be able to open and maintain a patient's airway when all other methods of airway intervention have failed. By performing an emergency cricothyroidotomy, you can establish an airway when no other means are viable and greatly increase the chances of saving the life of a casualty with airway obstructions or trauma. After this video demonstration, you will be able to identify when and how to perform an emergency cricothyroidotomy. When performing an emergency cricothyroidotomy, you must first identify the indications. They can include obstructed airways, congenital deformities, trauma to the head or neck, cervical spinal fracture, or severe allergic reactions. When performing the procedure, it is important to assemble and check your equipment. Look for a Scalple number 10 blade, an endotracheal tube, a 10 cc syringe, securing tape, curved Kelly hemostats, a Treac hook. Now that you have all of your equipment assembled, place the patient in a supine or semi-recumbent position and place the neck in a neutral position. Now locate your landmarks. This includes palpating the thyroid and cricoid cartilages and the cricoid thyroid membrane. Next, you want to prep the procedure. Using an aseptic technique, cleanse the incision site with alcohol or Benadine. Using your non-dominant hand, stabilize the thyroid cartilage. Then make a 1-inch vertical incision over the cricothyroid membrane. Then you want to visualize the cricothyroid membrane using the curved Kelly hemostats. Once visualized, make a horizontal incision on the cricothyroid membrane. Next, perform blunt dissection with the Treac hook to open the incision site. Next, using the patient's saliva as lubricant, insert the endotracheal tube no more than 3 to 4 inches. Next, inflate the ET tube balloon with 10 cc's of air to secure it in the patient's throat. Provide 2 breaths to ensure proper placement. Visualize misting from the patient's breath. If the ET tube is inserted too deep, deflate the balloon and retract 1/2 inch. Once complete, re-inflate the balloon with 10 cc's of air to secure the ET tube. Next, secure the ET tube using the securing tape. Once secure, it is important to monitor your patient. Give 1 breath every 5 seconds. There are complications associated with this procedure. For example, hemorrhage, esophageal perforation, and subcutaneous emphysema. This concludes the cricothyroidotomy procedure video.